Beach Radio 1160 and 1310 and MyBeachRadio.com proudly present Painless with Dr. Gabriele Jasper of the Jasper Spine Institute. On this show, Dr. Jasper will discuss new innovative techniques to get rid of pain while avoiding unnecessary spine surgeries. Here's your host, Dr. Gabriele Jasper.
Good morning. Dr. Gabriele Jasper here, MD. Again, live on Saturday morning, 10 o'clock to 11. I'm the interventional pain physician here to answer any questions that anybody has about pain, especially sciatica type pain, herniated discs, mostly pain derived from the spine. I'm located in Brick, New Jersey on Brick Boulevard, 74 Brick Boulevard behind the new Roy Rogers. My number is 732-262-0700. And you know what makes it interesting, this show? I've had a lot of feedback from some of my patients, and they say the best thing are when patients call in and they ask questions. They learn so much about pain because what it does, it stimulates me, Jeremy. Jeremy's here today. How you doing, Jeremy?
How you doing, Doc?
Jeremy's got a little bit of talk. He's going to be a little testimonial of something we've done on him lately. However, we need to have people call in at 732-505-1160, like 1160 radio, Beach Radio. What I like to do is talk a little bit about spinal stenosis. I know it's to talk about every week, but there's a new procedure that is called Vertiflex by Superion, and it's a phenomenal procedure. It takes me 10-15 minutes to do. You heard, if anybody is a repeater here as far as listening, you heard Vinny on the radio a couple times. You hear him on this show. You heard him, a live testimonial about Vinny. But the company that supplies me with the instruments for this procedure has informed me that I have done the most Vertiflex intraspinous spacers for spinal stenosis than anybody else in the United States.
Yeah, well.
So, and I think one of the main reasons is because I live in Toms River, Bricktown area, and we have probably the highest population of patients that have spinal stenosis. And that's pretty important. They're wondering why I do so many. And one of the reasons why I do it is because, and in fact, I wanted to say that I'm the only person in the area doing it. And the reason I'm the only person in the area, I've kind of developed a reputation in the past and present that I have very good hand-eye coordination. That's probably why I'm a pretty good race car driver, amateur race car driver.
Yeah, right.
But the fact that I have good hand-eye coordination, I'm very precise. And these are what the reps that sell the instruments from different companies, from different procedures I do say to me, that I'm very precise, I'm fast, they like the speed part of it, and safe at the same time, and efficient. I got a very high success rate in anything that I do that will in itself have a high success rate. I don't do anything that I don't think or has proven not to have a high success rate. Any of these experimental procedures that haven't been out and prove that they work, I don't do. I make sure that they prove themselves and they work. And this spinal stenosis procedure, where you can't walk very far, you try to walk and all of a sudden you're starting to have low back pain, sometimes even just standing up. You have low back pain, then you start to walk and all of a sudden you feel your legs getting heavy. You feel your legs, maybe some pain going down your legs, but it's mostly the aching that constantly increases the further you walk. And it gets to a point where if you don't sit down, your legs feel like they want to give out on you. Then you sit down, and it could be 5 minutes, could be 3 minutes. Pain goes away completely. Once the pain goes away completely, you get up and you continue to walk like there's nothing wrong until all of a sudden it starts hurting as you're walking. Some people can go 10 feet. Some people can go a half a mile. Depends on how severe the spinal stenosis. Some patients, when they come to my office and they say, Doc, I can't walk more than 10, 15 feet and I got to sit down. I mean, that's incapacitating. I mean, you can't have a life that way. You can't even get from your house to your mailbox. You can't get to your house to your car. You can't get to your car to the pharmacy. That's without sitting down. Those are the people you see with the walkers that have the actual seats built in. These people, when I do this procedure and they're able to walk. Some of them just could continue to walk. It's almost a cure. Of course, I hate to say the word cure. Spinal stenosis is a progressive disease. However, when you decompress the central spinal canal, and the nerves are free, and you can walk without chafing them, you can walk pretty far. But some patients are in their 90s, and they can't walk 10 feet. And I give them the ability to walk now 100 feet, maybe 200 feet. That's leaps and bounds compared to what they've been walking. They're ecstatic. They say, I have my life back. 90, 92 years old, that's a home run. So that's why I always bring this up. And the latest statistics on that, I don't think I've had one failure. I don't think I've had one patient that was not satisfied with this procedure. I mean, I just can't. Maybe I'm beating a dead dog here, but I just can't help expressing how it's just a great case. You give me a call if you have any of these symptoms. It's 732-262-0700. I think
it's. You mentioned something earlier, and I think it's important for everybody to know. Sometimes we're not live week to week. And during the summer months and a little into the fall, that's because Dr. Jasper, when he's not being a doctor, he is a race car driver.
Well, yeah, I mean that's every once in a while I pick up some kind of hobby, and I become a little obsessed with it. That's my personality, and that's probably why I'm so good at what I do. Yeah. Because when I do something, I have to do it to the completion, and I got to be the best at what I do. And I feel I'm the best at what I do as far as interventional pain. And I don't take any shortcuts. I can remember when I was a medical student, I see some of my friends say, you know what, let's go to the beach. I got a way we could pass the exam with no problem. I said, why would you want to do that? We're here to learn. We're here to learn. We're here to do the best we can, learn as much as we can so we can become good doctors. And I used to say, these people that continuously try to cut corners, why cut corners? When are you going to learn it? You're going to learn it later once you're a doctor? Now's the time to do it. So I've been dabbling a little bit in race car driving, mostly road racing.
And winning.
Yeah, and I started, I'm going to be 62 years old October 1st. And I started a couple years ago, I was 58. And I started as never racing ever in my life, except maybe when I was a kid driving up and down the streets and getting pulled over and getting tickets. But that's my only form of formal race car driving was on the street illegally. However, I took a few courses. I took the Belarus Racing School. I like to give a little support for them.
Yeah, a little plug for them. Right?
Yeah, a little plug for them. And they have a racing series, which I went from the first year out of 25 race drivers in 9th position, and the second year, which was last year, I came overall point standing 3rd position. This year, I got a good chance of winning the whole thing overall if the cars hold up. But anyway, that's a little sidetrack that give you a little personal view of what I do and why when I do something, I do it right. And I'm not going to stop racing until I become the best. So if I don't kill my patients say, Doc, stop racing. We need you. Now that we're on the subject, well, I guess it's not that subject, but Jeremy's talking. He wants to give a little talk about what we did for him, and I can elaborate on the details and how we did it. Jeremy, what did you want to say?
Well, over the last episodes of this show, I've mentioned that I was going through the process of getting a radiofrequency ablation. Okay, I was having trouble. The pain in my back was starting to radiate out again whenever I was walking, and the doc said, let's try this. I think you like to, and correct me if I'm wrong, like there are procedures that you can do, but you like to start with the simplest if it works, right? Like the less.
I mean, if a person comes in, let's say, with low back pain, maybe some pain radiating down into the buttocks area. At that point, of course, you need an MRI. I look at the MRIs. I read them. I read them right in front of the patient, and I have said this at the radio station before. By the time I'm done with the MRI in front of the patient, explain to him, these patients, as lay people who do not understand medicine or MRIs and never seen MRIs before, they can actually read their MRIs. Probably read their MRIs better than a lot of the other pain doctors out there who don't even read MRIs. They look at the report from the radiologist, and they're good reports. However, the radiologist has no clue where your pain is. So they're just reading an MRI, they're viewing it, and just reading a general dictation on what they see. Nothing related to actually your pain. So when I look at the MRI and I explain it to the patient, I know where the pain is. For example, if you got low back pain, let's say radiating a little bit into the buttocks, it could be a pinched nerve at L23. L23 is the upper part of your lumbar, or L12, the upper part of lumbar vertebrae. It could be a pinched nerve there. And the point is that you could have multiple pain generators. You got 3 or 4 pain generators that give the same pain. So my job is to figure out which one is specifically causing your pain. However, you can have multiple pain generators causing the same pain. In other words, you could have two. In other words, you could have arthritis causing that pain, and you can have a pinched nerve at 2-3, 3-4 causing that pain. 50% one, 50% the other. The way we figure that out is, for example, the procedure you had, it was a drawn-out procedure, mostly because of the way the companies want you to, they want you to do a specific way. That's their way of dictating how you got to practice medicine.
Regardless of what the doctor knows needs to be done.
Yeah, it's one of the things they push us around, and I think the way they force us to make it a long, drawn-out procedure, you got to do different types of procedures before you actually do the procedure. Test, redundant tests. They figure the patient's they're not going to feel good right away, so the patients might just drop out of the treatment, and guess what? The insurance companies don't have to pay for the rest. So the point that you brought up is that what do I do to make the patient feel better with the least invasive, the simplest, the safest way to do it, where the patient's going to feel the best quickly.
Right.
And for example, if you have L23 or L34, L12 pinched nerve, can cause low back pain, a little bit of pain into your buttocks and posterior legs, and so could arthritis. Arthritis, that's like I said, that's a long, drawn-out process to treat, whereas I can, within a minute and a half, do a bilateral 2-3 transforaminal epidural injection, and I'd like to talk about those a little bit later, and the patient coming off the table in 20 minutes will feel maybe 100% pain-free. Or if they do have half the pain coming from that pinched nerve and half from the arthritis, they'll feel at least 50%.
And what does that tell you, though?
Well, that tells me that part of the pain is coming from the pinched nerve. Okay. And if it's 100% pain-free right after the procedure, then it's 100% of the pain's coming from there. So I just made a good diagnosis. And we might, at that point, eliminate the even possibility of trying to attempt to treat the patient's arthritis, even though they have it. You can have arthritis of the spine. We all do after a certain age, except some people it hurts a lot, and some people it doesn't hurt at all. It's my job to figure out where the pain generator is coming from.
Right. So, well, in this particular situation, I had the radiofrequency ablation. Now, that's I'm gonna mess it up as to the description of what this actually entails. Do you want to?
Well, like I said, arthritis of the spine. The medical terminology, the diagnosis, spondylosis, where as you get older, your discs start to degenerate, and when the discs start to degenerate, they get smaller, and that the posterior part of the back are supported by these joints called the facet joints, and the facet joints become arthritic, and each joint is almost like a little knee joint. They got a capsule, they got meniscus, it's a joint where they can fill up with fluid. They become painful. Usually when you sit down, the pain goes away because those joints open up. You stand up and you get that low back pain. It hurts when you extend backwards. You're trying to lean backwards or to the right and left side. That's the way we diagnose it. Plus, we look at it on the MRI. You can see it clear as day. These joints become swollen and filled with fluid.
Yes, when you're going into the getting examined and the nurses are seeing you and they're asking you to get up on your tippy toes, go bend over left, bend over right, bend over forward. I mean, now you know what they're actually looking for when they ask you to do these things. Because as a patient, sometimes you just don't know, and it's all like wondering what's wrong with you until the doctor finally tells you. But it's a good insight to know, like, this is what they're looking for,
Yeah, and back to the arthritis is another progressive disease. It'll continue to get worse and worse and worse as you get older. It's wearing out of the joints. You get a bad knee joint, it gets so bad, or your hip joint, it gets so bad, you get a total hip or a total knee. And then the pain's gone. You can't do this with the facet joints in your spine, because these facet joints, there's so many of them. Just to open up the back and go in there and try to fix them, you're creating so much scar tissue that it's physically impossible to do that. You'll make it worse, right, with the scar tissue. And nobody's even, just theoretically, you just can't even do it. So nobody's going to invent any way to replace these joints. However, somewhere along the line, you got this anatomists that go and they take cadavers, bodies, and they dissect them, and they're trying to make medicine better. And these are the guys, the doctors and the scientists that are out there behind closed doors, and this is what they like to do. And they figure out ways to make my job easier to help people. And they found that this joint has a little teeny nerve, probably the diameter of a thread, maybe a little bit thicker. And that nerve comes out of that joint, and it actually brings pain sensation to your brain. It tells your brain you have pain in that joint. When you're over 50 years old and you're not a gymnast, where you're on parallel bars, or like the 14-year-old girl that is a gymnast and bends over backwards on the horse thing. I don't know what it's called, but they need to know where the pain is, because they'll extend their back so much that they'll feel so much pain. And if they didn't feel the pain, they'll break their back. They need it. When you're over 50, over 60, into your 80s, you're not going to be a ballerina or a gymnast. Right. And there's no need for you to feel that pain. So what I do is, what Jeremy had was a radiofrequency ablation. I heat those nerves up at 80 degrees Celsius for 90 seconds, and it destroys that nerve. It denaturalizes the protein, and there's no more, what they say, propagation. There's no more electrical impulse can go through that nerve. It stops. So the pain is gone. You don't feel the pain coming from that joint anymore. It's really, we've been doing this for over 20 years. And the sad thing about it, there's so many people out there that have that problem, and for the last 20 years they could have had it fixed. Well, maybe 20 years ago you didn't have arthritis, but there's and this is why I'm doing this radio station. Well,
for me, the process was it was a certain amount on one side and the other of the spine. Do you know
this is that hoops that the insurance companies make you go through. I'm not even going to mention the details about that, because it just upsets me on what they make us do. I make the diagnosis on doing a good history, a good physical, and I look at the MRI, and I know this patient has spondylosis, arthritis of the back, and I could treat that with one treatment, one day, done, 15 minutes, and the pain's gone. However, the insurance companies draw it out. You can detect a little bit of hostility and anger in my voice, but they draw it out to almost 2-month process. A patient, and you have to test it with local anesthetics times 2. The patient's like, Doc, first of all, it's a hard concept to understand to begin with, and then you're giving this patient injections just to test it, and the pain control that goes away for 15 minutes, and they come back a week later, 2 weeks later, and say, Doc, it didn't work. Well, of course it did. It worked. You were 100% pain-free right after the procedure, and that's what the insurance companies want us to do. Now we can go to the next step. And a lot of those patients, they go to you, and there's another reason why I got this show here, to explain why, you need to trust your doctor, and they do some procedures as diagnoses, and it's part of their way of figuring out what's wrong with you. And if you get an injection and it only lasts for 2 days, don't go run into a surgeon and get major spine surgery. Go back to the doctor and explain it to him, and they'll explain to you why you're not still pain-free, because it was probably just a test. Right. A lot of people say, Doc, don't explain it to me. I trust you. Just do it. No, you need to understand what the doctor's explaining. You got to sign an informed consent, and you need to understand that. So how you feel, Jeremy?
For me, after the first one, I was okay, a little okay, and then the second one came. My hopes weren't exactly high, just like anybody. Is this going to work? Isn't it going to work? And then I was having trouble walking at all. Really, the pain was just radiating down my leg, all around my buttocks, and so I think the last time we went live, I wasn't here. I was at a convention, and I walked the entire day. The entire day I was just pushing, and without a lick of pain. Absolutely no pain. I was absolutely amazed by it. Just that Wednesday before, I had the final radio frequency ablation, and just a few days later, absolutely no pain. And that's been 2 weeks now, 3 weeks.
Yeah.
And still, I have no pain whatsoever. I can walk as long as I feel like walking, and I'm fantastic. I couldn't believe it. You know, I mean, and I think that's one of those things where, you know, people need to realize that these things work. You do have to listen to your doctor, and you got to listen to the instructions the nurses give you, you know, and all of that, because they will get you feeling no pain.
I bet you they want to take a break here. Let's take a little bit of a break.
All right.
And we'll get back to you soon.
You're listening to Painless with Dr. Gabriele Jasper. More next on Beach Radio 1160 and 1310 and mybeachradio.com.
Medicines save millions of lives each year, but they are powerful, and drug interactions with other medications, food, alcohol, or herbs can cause problems. I'm pharmacist Karen Reed, and I've got some tips that will help keep you and your loved ones safe and ensure you get the full benefit of prescription and over-the-counter medications. First, ask your pharmacist the right questions like these people are doing.
What's the name of this pill, and what's this supposed to do?
Should I expect any side effects?
Is there any particular time of the day I need to take this?
Should I take it with food?
Second, your pharmacist may be aware of your prescription medications, but he or she also needs to know about any over-the-counter medicines or herbal remedies you take regularly. Americans spend billions of dollars on medicines, but money is wasted when they aren't taken correctly. This has been a public service message from the American Pharmacists Association.
My name is Gabriele Jasper, MD. I'm a physician who practices interventional pain. My office is famous for not treating patients with narcotics. There are so many side effects with narcotics, and it doesn't treat the cause. It just covers up the cause. What I concentrate in the Jasper Spine Institute is getting rid of the actual cause, the pain generator. If a patient has a herniated disc pinching a nerve, I get rid of the herniated disc. If the patient has arthritis, I can get rid of the arthritic pain. We can treat the arthritis with specific types of injections, which are very accurate based on the fact that at the Jasper Spine Institute, we have the state-of-the-art instruments and live x-ray machines. I am using the new techniques in regenerative medicine, stem cell therapy, platelet-rich plasma. For example, arthritis of the knee, torn meniscus, hip arthritis, torn rotator cuff, and also it's great for tendinitis and bursitis.
The Jasper Spine Institute, 74 Brick Boulevard in the Brick Pavilion. Call 732-262-0700. Now back to Painless with Dr. Jasper on Beach Radio 1160 and 1310 and mybeachradio.com.
Now, we've been on the radio station for almost a half hour now, and nobody's called in. Is it possible that nobody's out there listening to me? I'm getting very lonely over here. I mean, I have to encourage people out there, don't be shy, because like I said in the beginning of the show, my patients, the new patients that come in, they say, well, the reason I'm here is because so-and-so called in, and that question was exactly what I had. So, I mean, you don't have to come in and you don't have to call in and ask a question. If you have any symptoms that like the spinal stenosis, about the fact that you can't walk too far and you have to sit down, even if you have that, call in and give us your experience. You know, what are you doing about it? Well, I must have stimulated somebody. We got somebody now.
Oh, there you go.
Calling in. Hello, it's Dr. Jasper. Who's this?
Hi, Dr. Jasper. It's Barbara.
Barbara, how you doing?
Well, I could be better. I've had better days.
So I guess you have pain.
Yeah, I wanted to ask you, you're talking about lumbar stenosis, but what about cervical stenosis?
Cervical stenosis is, it could be a serious problem. Now, how do you have that, Barbara, or is it somebody else?
No, I have it. And I also have another complication. I need a hip replacement, the right hip, which the ball has completely deteriorated. But then I went to the doctor, and he basically wants figures I might need spine surgery prior to doing the hip because he feels that there's a problem coming from the spine. And you know what? I really don't want spine surgery. I've had it already.
Well, all right. That's a good point right there. There is no reason, off the top of my head, I'm going to make a blanket statement here. There's no reason to have neck surgery prior to a hip. If you have a disintegrated hip, you can easily make that diagnosis by doing a hip injection. The pain goes away for a half a day or 20 minutes or a week, and it comes right back. That's a good diagnosis of saying you have a hip, severe pain from the hip. Now, you look at the X-ray. And if your joint is completely destroyed, what does that possibly have to do with the neck? You have
No. It's not the neck. That's the lumbar region. He needs to do surgery. But I also have stenosis.
Oh, wait a minute. You went from stenosis of the cervical spine, and then you
Correct.
talked about an operation of the spine, and then you talked about you can't have it unless you have spine surgery. You can't have hip. Now, you didn't mention about the lumbar. Lumbar is a completely different story because you could have pain coming from the spine that can mimic. I'm sure you're listening to the station. There are pain generators that mimic each other. Now, if the doctor thinks that you have pain coming from the spine that is exactly like the pain coming from the hip, now this is my opinion.
Mm-hmm.
You don't want to operate on the spine. I don't want anybody to operate on the spine. I wouldn't want anybody to operate on my spine if they think that 50% of the pain in my hip is coming from the spine and 50% is coming from my bad hip. Logically, hip surgery is a foolproof. There's always you always could have a complication, but the chances of a failure of lumbar spine surgery doing a traditional open spine surgery is very, very high compared to doing a hip operation. There's virtually no failures with that, unless maybe you have an infection intraoperatively or something like that. That's just a complication. But it's so much easier to do a hip operation, a total hip, than spine. So you're right on the money. Now, if you have lumbar spine problems, let's talk about that. I'm the master of the lumbar spine. That's my forte. And if you've listened to my radio station, you know what my goals are. And spine surgeons don't like me because I do things to avoid any major traditional spine surgery. I do minimally invasive spine procedures where if you got a herniated disc pinching a nerve, I could take that herniation out endoscopically with a 1/4 inch or 1/3 of an inch incision, 4 millimeter incision with a scope. I go in there on the direct vision. I could see the herniation on a big high definition TV screen. I go in with an instrument, pull it out, and you're cured. Pain's gone. I mean, I virtually eliminated the reason to have traditional open big spine surgeries. Now, what's wrong with your spine?
Well, I have had laminectomy in the past and discectomy in the past. I think twice, two laminectomies and two discectomies and one laminectomy. And
so you already know the failure rate. I mean, you're living proof of the failure rate. And can I ask you a question? Did you get worse after these procedures?
Actually, no. I did have success for several years until my knees and my hips started going bad. And then I'm back to where I was prior to the surgery.
Okay, that's a good excuse to say that your back surgery failed. A lot of these guys say, your knees went bad, your hips went bad, so that made your neck, your back bad.
Lumbar,
that's not necessarily true because what happens is when you do a laminectomy, you take out the bone. And now the problem, like the disc that's pushing the nerves up against the bone, there's no more bone there, so you don't feel pain. However, the scar tissue starts to fill in over years. Could be 6 months, it could be 5 months, and that scar tissue becomes almost like bone. So it's almost like they almost like didn't even take out the bone anymore because now you got that scar tissue. The problem is a lot of times they don't take out the cause, which could be the herniated disc. It could be a bone spur putting pressure against the nerves. So where's your pain?
It is the lower back, and it radiates down through the buttocks. I do have hip pain, like I said, because the ball of the hip joint is completely deteriorated. So it's basically the femur is going up into the joint where the ball should be.
Well, that's called avascular necrosis. Have you heard that terminology?
No, I haven't.
That's called avascular necrosis. That means that your hip is totally destroyed, and if you got severe pain in your hip, then there is no question to ask. You go to an orthopedic surgeon who does not do spine surgery, and you know what they're going to tell you? They're going to tell you, do your hip. But you go to an orthopedic surgeon that does spine surgery, they might say, do your hip, or they might say, let's do the spine first. But
yeah, you're absolutely right there, because I did go to a neurosurgeon about 2 years ago, and he says, I'm not touching your spine until they do the hip.
Oh, see that? And I didn't even mention that. I said orthopedic spine surgeon, orthopedic surgeon, right? You go to a neurospine surgeon who doesn't really, they're concentrating on your spine. So that's a smart neurospine surgeon saying, take care of the least invasive procedure first. That's going to give you the best results. That's my theory. Do the least invasive, the safest, and the one that you're going to get the best results from, and that's hip surgery.
Yep.
But I don't do hip surgery. I concentrate on the spine. So that's why I'm trying to elaborate. How old are you?
64.
64. I mean, there's 64 years old. You're very young to have all these spine problems, and this is what happened. How old were you when you had your first spine surgery?
Probably 48.
Yeah, 48 years old. 48 years old. You know, I like I said, my goal is to avoid all these surgeries because it becomes a vicious cycle. You do one surgery, open traditional spine surgery, then you need to do another one, then you need to do another one. It's a vicious cycle. I mean, and doesn't have to be like that. And if you do have to have repeated spine surgeries, you're better off doing minimally invasive, and there's no scar tissue formation. It's a same-day surgery. You go home the same day with a Band-Aid.
I did have one question, though, about this particular type of procedure. If you're actually killing the nerve, are you now avoiding, maybe that's not the word, are you creating more damage now that you can't feel with it?
No, that's a good point. And remember when I told you that this is a very small nerve and it has one main purpose, and that's telling you have pain coming from arthritis of the joint, the facet joint, which has nothing to do with the surgery that you've had. In other words, the surgeries that you had was most likely because of the fact that you might have had stenosis, pinched nerves, herniated discs, which is different from the arthritis. And you're right. You know, you're very smart. That's a good way of looking at it. Pain tells you you're hurting yourself. If you take away the pain, you might hurt yourself. No.
Right.
Like I said, when you're over 50, you're over 60, arthritic pain, you don't need to feel that. There's no need to feel arthritic pain. And that's all it does is it gets rid of the pain from the arthritis.
Which is going to occur anyway.
Yeah.
Okay.
Yeah, that has nothing to do with it. That's actually almost a miracle thing. Whereas if you have, see, the way you got to look at pain and disguising pain, I had a patient that came to my office yesterday with a hernia, had symptoms of a herniated disc, had sciatic pain going all the way down the leg, had weakness, had no MRI. I have no idea where that herniated disc is. I have no idea how big the herniated disc is. This patient had no weakness at this time, just a little bit, but they didn't have any frank weakness. They could stand on their toes and on their heels. The guy was like, I said, today's Friday. It was early in the morning. I said, go get an MRI today or Monday morning, and I'll see you Monday afternoon, and we'll get to the bottom of what's going on. And he was like, well, Doc, can you give me some pain medication for the weekend? I said, absolutely not. That's where it becomes dangerous because he is protecting his nerve because the nerve is being pinched. When he feels the pain, he gets in a recliner in a position where it doesn't hurt. That's what he needs to do. But if he takes, I had a patient one time, took pain medicine from another doctor when I told him not to. He came into my office 2 days later. He had foot drop. He had paralysis of his foot. the herniation became probably twice the size because you're covering up the pain, and now they're doing stuff that they couldn't do before. That's when you can't cover up the pain. When you treat the medial branch nerves for arthritis, that's a godsend.
Okay.
So you going to come and see me?
Yes, I am. I will look you up. Where do you have a number for your office?
Yeah, it's 732-262-0700.
0700 262 0700. Okay, thank you very much.
You're welcome, Barbara. It was nice talking to you. I think everybody learned a lot with this conversation. Thank you.
Thank you. God bless you. Bye.
You too. I mean, that was a classical question. These questions they're priceless. They're really priceless. And we got another patient. No, not a patient yet, but probably somebody's patient on the phone that wants to ask some questions. Who is this? Who's on the phone today?
Hi, this is Nancy. So I'm 77, and I have all those symptoms that you described in the beginning, spinal stenosis, a little sciatica. That's not really why I'm calling, because whatever is causing this problem, many facets, but now it's shifting down, and I looked this up. That's why I know the words. I have innervation of the pudendal nerve, and I don't like that at all. So I looked it up. There's two branches, one to the anus, one to the GU system, and that's what's bothering me. I have not sought any information other than a book about this, and now I'm concerned because...
But first question I'm going to ask you, where's your pain?
Well, I just have numbness as I'm walking.
So you get numbness around the the crotch area, the anus area. This is where your numbness is?
I feel like if I was pregnant, I would have a saddle block and I would be free of pain.
Yeah, this is a very important symptom. This could be the beginning of what they call cauda equina syndrome, where you could have such bad spinal stenosis that it's putting pressure on the nerves coming down the spinal cord, creating these symptoms. We're talking on the radio here, and now you're not my patient, but we're going to have to talk about some intimate things. For example, how are your bowel movements?
Well, that's just it. I always felt like I had to go, and it never hit me until I had the urinary situation last week. And I never felt like I was going to be incontinent, but I just had the urge to go. And so now I'm putting everything together, and I'm thinking, no, that's it. I have nerve innervation there, and it's
Nancy, forget about the pudendal nerve. This is your classical cauda equina syndrome. Anybody out there listening that knows a cauda equina syndrome, they're probably saying, yeah, I knew that. That's what it is. Because you have your classical symptoms. First question was, how's your bowel movements? The second question would have been, how's your voiding? How's your urinary tract? Are you incontinent? Do you have to they have urgency, which means that all of a sudden you got to go? These are all classical symptoms. And the symptoms are derived from spinal stenosis. It could be from chronic central canal stenosis, which it sounds like that's what you have because you say you have that problem walking. So those are the first symptoms, and this is almost the end stage symptoms of central canal stenosis. What you need is a decompression of the canal. Now this is based on your symptoms. Of course, I'd have to look at your MRI. I have to make an official diagnosis. I got to look and see what's going on there. And you probably have a central canal stenosis. How old's the MRI that you have?
It's about 3 years old, and there's no mention of S4-5, any kind of issues there, but obviously that's what's troubling me now.
Well, first of all, 3 years. Did you have these problems 3 years ago?
No, it just started like a couple of weeks ago.
Okay, so what you need immediately, within days, probably early next week, you need to have an MRI of the lumbar spine. Urgency when you have to urinate. It could be an infection. You probably need to get your urine tested. We go through the whole procedure. There's a protocol that you follow, but the first thing you need is, if I were you, I'd call my office and you tell them that Dr. Jasper on the radio said that you need to come in first thing in the morning. and I'll do a complete history and physical examination on you, and I'll send you for an MRI that day. In fact, I'll get you in that day. We'll call it an emergency MRI because we need to get to the bottom of it ASAP and see why this is happening. And it could be a bad stenosis that needs to be decompressed pretty quickly.
I wouldn't doubt that. Thing that, like I said, I'm just scared to go out any place now because that happened to me once. And fortunately for me, I'm not urinary incontinent ever. I have no stress incontinence at all. But when I was walking to my car, I almost died because I thought I was going to, urinate all over the place. But when I sat down in the car, it was close. The symptoms went away.
You just described spinal stenosis.
It's awful. I know.
You made your own diagnosis. I'm glad you called in. You were listening, and you sound like a smart person. Come to the office. Let's get you in there to get a new MRI, and we'll decompress that immediately, and those symptoms should go away.
Unfortunately, I'm leaving for a few days. I won't be in town, unfortunately.
Unfortunately, sounds like this is pretty important. But probably the reason you got to leave town is important too. You're going to go down in Irma and help everybody down there?
No.
We got to mention Irma. They said mention Irma. So we got Nancy. Nancy, she's got spinal stenosis, and she's going to help people in Irma.
No, I'm not.
I'm just kidding.
But no.
Well, you know what?
It makes sense, and I kind of thought that what the problem was.
Look up cauda equina syndrome.
Okay.
And cauda, it's in Latin. Cauda means tail.
Right.
And equina means horse. And when the spinal cord comes down as a solid spinal cord, it reaches around level L1, 2, and then it breaks off into these long, stringy nerves that eventually come out of the spine into the neuroforamina. And if you look at it, it looks like a horse's tail.
Yeah, that phylum.
Yeah, it's called cauda equina. Now, when you put pressure on that, all the symptoms that you have become cauda equina syndrome. So look that up, and you'll see that all the symptoms you have.
Okay, I will. I will.
Give me a call when you get back.
You'll hear from me again, but not for at least another week.
All right.
So
feel better.
Thank you very much.
You're welcome.
It's assuring to me because, in my mind I thought, but now you've more or less confirmed it. But I confirmed it to myself because symptoms are there.
Yeah, you're smart, but forget the pudendal nerve. I mean, pudendal nerve is not directly being affected. It's being indirectly affected way upstream, like in the nerves in the spine.
Yeah. Well, I remember they used to do those pudendal blocks for the ladies.
Yeah.
Okay.
All right, honey.
A million.
Well, anytime.
Bye.
Bye. Well, that was a good one. Yeah. We just brought up a new topic, cauda equina syndrome, which I don't think we've ever mentioned.
I've never even heard of that. Yeah.
And people aren't aware of it. They think, something's happening. They don't know what it is. They think maybe they got a urinary tract infection, which could be. And then all of a sudden they got bowel movements. They become constipated. They get diarrhea. And it's nothing consistent. And they get what they call that what she said, that saddle block. You get numbness all around your perineal area, all around your crotch area, your anus area, and it becomes like you're wearing a pair of underwear that everywhere the underwear is numb.
No, yeah.
And you can't feel much down there. But that's not an emergency operation, but it becomes pretty urgent because of all those symptoms. Some people might even consider that emergency, depending on how severe the symptoms are. And she has pretty severe symptoms. However, I guess in her own mind, it's not severe, unless she's got to go somewhere very, very important. But I would jump on it right away. She needs an MRI. Well, thank you very much for those phone calls. Maybe we'll take another short break. Thanks.
Painless with Dr. Jasper. We'll be right back on Beach Radio 1160 and 1310 and mybeachradio.com.
These are the voices of real people who are turning their lives around at Narconon Vista Bay.
4 DUIs in 5 months.
I was doing meth.
I was a heavy user of marijuana. I never thought it would happen to me.
Positive, effective change is only a click away at drugrehab.net.
I mean, it's like you come into a family to change. I mean, everybody, you're around positive people. You don't hear drug addict, you don't hear alcoholic. Everybody got a goal. It's just good for everybody.
What you hear at Narconon is nothing but positive reinforcement.
If you or a loved one need help, contact Narconon Vista Bay at drugrehab.net.
Everybody had a dream.
You feel just 100% better. You are just clean inside and out.
Just like drinking became my second nature when I was out there, now these steps have become second nature to me, and it's no longer go pick up a bottle and drink.
You have so much in life to accomplish and so much that you can reach for if you just shoot high.
That's drugrehab.net.
You could do it. It's nothing.
My name is Gabriele Jasper, MD. I'm from the Jasper Spine Institute. I am an interventional pain physician. We got Vinny today. His main problem was that he couldn't walk very far. He'll tell you all about it. So, Vinny, how you doing today?
I'm doing wonderful, doctor. I was finding that the power in my legs, the feeling in my legs was not where it was supposed to be. So finally I talked to Dr. Jasper, and he had told me about this new procedure that he had about putting this little spacer. So he did it. I don't remember how long it took. It wasn't long. I guess it was maybe half an hour, something like that. Believe it or not, when I got off the table to stand up for the first time, I could feel a difference in my legs. My legs felt powerful. They felt strong. The first time I walked up the stairs, I could feel the difference in my legs. I didn't have to hold on to anything. I didn't have to grab the banister. I mean, I just walked up the stairs, and it was amazing.
The Jasper Spine Institute, 74 Brick Boulevard in the Brick Pavilion. Call 732-262-0700. Painless with Dr. Gabriele Jasper continues now on Beach Radio 1160 and 1310 and mybeachradio.com.
We're back. Doc.
Hello, how you doing? This is, we have a new caller. Who's calling? What's your name?
Yes, this is Carolina Grasso from Lakewood, but I have an unusual question for you. I have a brother and a sister in Italy, and they have, a lot of pain, a lot of problems, and I was wondering, do you know anybody, I know you went to school in Italy, and I was wondering, do you have any place you could send them over there, or can they come here, maybe what they need to do first?
Scherziamo, possono anche venire qua a parlare italiano con me.
Lo so.
Parliamo un po' italiano perché ci sono tanti italiani qui fuori che stanno ascoltando. Lo facciamo per 5 minuti così. Allora, da dove vieni in Italia?
Da Salerno.
Salerno. Allora, i tuoi parenti vengono da Salerno?
Sì, abitano in Italia, però vicino a Salerno.
Brava. Yeah, we better start talking English, otherwise everybody's going to turn the radio up.
Right.
Well, that's the great thing about it. I have patients all the time coming from Italy. When they do is they fly in. They fly in, let's say, before the weekend, and they rest. They enjoy the weekend, and they come in on a Monday. And but by the way, what I like to do is if somebody comes from another country, which I have quite a few patients that do that, they send me their MRI, have it done there, and they send me a disc, and I go over the disc, and then when I go over the disc when they send me the disc, they give me a list of their symptoms. I go over their symptoms, and I read the MRI, and then I call them up directly. I call them up usually in the morning because this way we can get them. 6 hours difference, and we talk about it. I give, I don't speak German. Sometimes I have people from Germany call, but most of them speak English. But I get a lot of people from Italy that call me, and we discuss what they have. So I already know what I'm going to do to these patients. So if I can do a procedure on them that will help them, I have them come in on the weekend, and they come in for the initial evaluation on a Monday. And if they do need that minimally invasive surgery that I do, we do that on a Tuesday, and we set them all up for Tuesday. They come in, they don't eat. They got the anesthesiologist, they interview them, and I do the procedure. And some people within 2-3 days can go home, hopefully pain-free.
Yeah, I know my brother would do that in a minute. The only thing is, I would have to. He would have to know. Maybe you would have to know where the pain is, or what kind of MRI does he need, where.
Well, he needs that's definitely not got to know where the pain is. If the pain's in the neck and down into the arms, he needs a cervical MRI. If the pain's in the back going into his legs, then he needs a lumbar MRI. So of course, this is what. I'm sure is being treated out there by somebody. And there's some minor procedures like epidural injections that, there's plenty of doctors in Italy that do that. Believe it or not, there's a lot of good doctors in Italy.
Would it be possible for you to talk to him about what he needs? Or
absolutely.
You do speak Italian, which that's a great thing.
Yeah, tell him to call my office. You got the number 732-262-0700. Tell him to call my office within office hours, and talk to the front desk. Well, he can't talk to the front desk. I've had patients call him and do not speak English, they speak Italian, and they come running and say, Dr. Jasper, I don't understand what this guy's saying. Can you talk to him? And I'll get on the phone right away unless I'm in an operating room.
Well, good, because I know you might get the office personnel, and then they don't speak Italian.
Or what you could do, I got an idea. What you can do is he can call you and tell you when he's going to call, and then you call my office, and we're making an appointment for him to call me.
Okay. Oh,
how's
good.
that sound?
That sounds good. And I also have my sister, but she will not come to this country. She never came here. She never wants to come. But you probably will really help her a lot. But in the meantime, she just doesn't.
Well, you know what? Maybe if I talk to her, she'll come. But it'll cost you a good plate of spaghetti.
Well, she really makes good spaghetti. My sister does, but she's in Italy. But anyway. Is there a place in Italy that you could recommend in case he doesn't want to come?
They're down by Naples, Salerno area.
Right. Naples.
Yeah, I haven't been to Italy in a while. I really have to think about who does these things. I have to think about that. I don't know too many people off the top of my head over there because most of those guys send their patients to me to do the procedures.
Yeah. Well, that's why there's no. Really, they don't know where to go there, and it's it's a problem. But there's so much pain, both of them.
Yeah.
And
I'm gonna look. I'm gonna call my office. What is your name? Is Carolina?
Carolina Grosso. Mm-hmm.
Carolina Grosso.
It's 732.
Yeah.
364-6174.
6174.
Right.
Carolina Grosso?
Right.
All right. I'll give you a call. I'm going to try to do some research who they can go see. In Salerno?
Right. There's Battipaglia, there's Eboli, there's those little towns there. But
hey, we're from Provincia di Caserta.
Oh, wow.
Non è lontano. Non è lontano.
No, non è lontano, veramente. E speriamo che potete trovare qualcuno che può aiutare, a mia sorella specialmente, perché lei non verrà qua.
Penso io, non ti preoccupare.
Grazie molto.
Buona fine settimana. Have a nice weekend.
You too. Thank you so much, Doctor.
You're welcome.
Bye-bye.
Bye-bye. Bye. Okay, we're down to 4 minutes. This has been a great show.
Yeah, it has been.
There was a lot of other topics that we wanted to talk about, but this was a good show. I wish I could do it. I wish I could do it live every single week, but I'm just such a busy guy. Today, I was very nervous about doing it today because it's Pomodoro weekend. In other words, tomato weekend. This is where we jar our tomatoes. Right. I'm sure Carolina Grosso knows exactly what I'm talking about. We usually do about 20 bushels of tomatoes every year, but and we usually do it the last weekend of August. But I had a pretty big race. Had a pretty big race and on the last weekend. So what I did was I said I'll do it this weekend. But for some reason, the way the weather is, there were no tomatoes out there. So I'm probably not going to do tomatoes this year. Thank God I got some left over. All right, so we got 3 minutes left. I don't know. You want to say anything, Jeremy?
I'm good. I'm just happy to feel great again. No pain, and it's amazing to me.
All right, so let me go through some information. I'm Gabriele Jasper. I'm an MD, interventional pain physician. My office is in Bricktown. The name of the practice is the Jasper Spine Institute. I have my own surgery center there. We do the procedures in a clean environment. I got a crew of nurses and ancillary people there that are fantastic. They've all been working for me for many years. I call my office in Bricktown on Brick Boulevard, behind. It's right across the street from Burlington Coat Factory and Stop and Shop, and Bank of America. It's 732-262-0700.
And if we didn't get to your call today, hold on, and we'll get to you next time.
Yeah, so make sure you tell your friends to listen to this radio station. And even if this one repeats in 2 or 3 weeks, it's still a great show.
Oh, sure it is.
A lot of information.
Yeah.
But I enjoy doing it, and I'll see you next week. Thank you very much.
Thank you for listening to Painless with Dr. Gabriele Jasper of the Jasper Spine Institute. For more information about the services he provides, go to jaspermd.com. Be sure to listen to Painless every Saturday from 10 a.m. to 11 a.m. on Beach Radio 1160 and 1310 and mybeachradio.com.